be assessing your baby now. We're doing the systematic examination of the newborn baby, and in this check, I'm checking for focusing on the eyes, the heart, the testes, and the hips. And this is usually done to detect or denote any sign of abnormality on baby. All right. If you're happy for me to do that.
Yeah, that's fine.
Okay, okay. I'll be carrying you along this process as I go along, okay?
Okay.
Yeah, and letting you know. So first I'm going to make sure I undress baby and then cover baby with a towel, and then I'm checking baby's temperature to ensure it's normal and baby is warm. But if baby is not warm, I might need to give baby to you for skin to skin. But if baby is warm, I'm going to be so I'm checking the temperature now, and yeah, baby seems to be warm. It's 36.7. Next, I'm going to be starting with the head. Um, before I start, do you have any say any family history of any condition in those four areas I just mentioned?
No, I don't.
Okay, all right. So that's fine then. I'm going to be starting with the head, checking the fontanelles, the anterior and the posterior fontanelles, seeing if it's patent or if there's an extra fontanelle. I'm also looking at the sutures if they are in line, and then I'm checking if the fontanelles, the anterior fontanelle is swollen or sunken. Sunkenness denoting dehydration, and swollenness it's been swollen, denoting some signs of chromosomal abnormalities if it's excessive. So if any of this occur, I'm going to be noting it down. Then I'm also telling Natalie the anterior fontanelle closes at 18 months of after birth of baby, while the posterior closes around 6 to 8 weeks of age. Okay. So
Okay.
you'll be expecting that. Next, I'm going to be looking at the eyes now, the eyes of the baby, and also looking at its alignment with the ears of the baby, and I'm seeing that it's in alignment now. And then I'm looking at the eyelids as well, and checking if they are in alignment, the eyebrows, and looking at the length of the eyes, and checking if the pupil is at the center of the eyes. Then checking for the color of the cornea as well, if it's white. Next thing I'm going to be doing is using my ophthalmoscope to look at the
Just use your pen.
looking for the using my ophthalmoscope to look for the red eye of the eye in the retina. I'm taking a look at it. So depending on the ethnicity of the baby, the red eye can be red or yellow or orange color. So I've taken note of that. And next thing I'm going to be looking at the nose of the ear. I'm also, when I'm looking at through the eyes, I'm looking for signs of cataract, which is congenital cataract, which can be opacity of the lens or cloudiness of the vitreous humor. Next, I'm looking at the bridge of the nose and looking if the two nails of the nose are patent. Then I'm looking at the baby's cheek if there are signs of birth trauma, and also looking at the lips and mouth of the baby if there is presence of cleft palate and cleft lips, and also looking at the tongue if it's pinkish or if there are abnormal signs of marks on it as well, whitish signs, and also looking at the epiglottis and the tonsils and ensuring they are in place. And I can be using my tongue depressor as well to bring the tongue down, and also check for all of these signs, and also checking for the presence of an extra tooth in the baby. Then I'm also doing the head lag reflex as well by dropping the head on the other arm gently to see if, or holding the baby and see if the baby would extend its head backward, and if it's really floppy. Then next I'm going to the neck and checking if the neck is webbed, if the baby has a webbed neck or is long. And webbed neck denoting signs of chromosomal abnormality in Down syndrome. And then I'm looking at the clavicle of the baby, if it's broken or if it's in line. Then I'm going to be looking at the chest, doing the capillary refill for checking if it returns 2 to 3 seconds in less than 2 to 3 seconds. Then when I'm done with that, I'm going to be checking for the position of the heart by placing my hand across the baby's chest in this manner to see if the apex, if I can feel for the apex of the heart, apex bit of the heart at the left, which is the normal position. And then I'm going to be listening for the heart rate of the baby for 1 full minute at the apex of the heart. And after listening for 1 full minute, I'm listening at the four valves of the heart to listen for the sounds at the four valve of the heart. First is the atrial valve, which is at the towards the right of the sternum at the second intercostal space, listening for 1 full minute. Next, I'm going to the mitral valve, to the pulmonary valve at the towards the left of the sternum at the second intercostal space, listening for 1 full minute. Next, I'm going to the tricuspid valve towards the left of the sternum at the fourth to fifth intercostal space. I'm listening for 1 full minute, and then I'm going towards the mitral valve towards the left of the sternum as well at the fifth intercostal space, and I'm listening for 1 minute. Then I'm going to be listening to the four lobes of the lungs at the right and the left upper and the right and the left lower. Then when I'm done with this, I'm going to be looking at the limbs of the baby and checking if it's floppy, and then counting the digits if they are 5, 1, 2, 3, 4, 5. 1, 2, 3, 4, 5, and also checking for the presence of palmar creases, which should be 2 palmar creases there on the palm of the baby, and also checking for the grasp reflex by placing a finger on the baby's palm to see if the baby grabs it, and I'm okay with that. Then I'm going to be palpating the abdomen to check for presence of any organomegaly, or if there is swelling of the edge of the liver at the right side, which can denote some signs of heart disease. Then when I'm done with that, I'm going to be assessing the respiration of the baby, counting respiration of the baby for 1 full minute as well. Then I'm also looking at the cord to see if there are signs of infection, if it's red, inflamed, if there are signs of bleeding on it or pus on it. And I'm also educating Natalie about the care of the cord and telling her that it's going to be falling after between 1 to 2 weeks after birth of the baby, and she should try to keep it clean and dry at all times. Next, I'm going to be looking at the genitalia of the baby, and then if baby is a girl, I'm going to be looking at the labia minora and labia majora and checking that they are present and they are not edematous, and also checking for any signs of pseudo menstruation or vaginal discharge, which can be normal in a female baby because of the maternal hormones, mother's hormones. Then I'm also looking, if the baby is a boy, I'm looking at the testes and looking at the penis as well to see the position of the urethral opening, which should be normally situated at the center of the penis. But if it's that's the tip, at the center of the tip of the penis. But if it's above, which is epispedia, or below, I'm going to be taking notes and referring for further checks. And next thing, I'm going to be palpating for the presence of the testes, which should be at the if it's descended or not, or if it's present. So I'm palpating from the inguinal canal, and if I palpating one after the other, if I find one, I'm going to hold it and then palpate to check for the other. If there is unilateral undescended testes, I'm going to be referring to the GP, which GP is going to be checked. The GP is going to be assessing the baby again, doing the NIPE on the baby in 6 weeks time. So I will take note of that and let the GP know of this. And then if it's bilateral undescended testes, I'm going to be referring within 24 hours for the pediatrician to assess the baby and know what to do next. So when I'm done with that, I'm going to be doing the hip examination. First, I'm doing the Ali sign by placing the 2 feet of the baby on the bed to check if the legs are equal, and looking at the level if it's equal. If one is shorter than the other, it can be a sign that the hip is dislocated. So when I'm done with this, I'm going to be doing the Barlow's test, which is to check for dislocatable hip. I'm pressing one leg at a time of one leg of the baby at a time downwards onto the bed in a way of pushing the femoral head out of the acetabulum. After doing this, I'm doing for the second leg to check if the hip is dislocatable. Next, I'm doing the ortholannis test, which is rotating one leg of the baby outwards in one circle to see if the head of the femur can return to the acetabulum. This is to check for a dislocated hip. Next, I'm doing the second one as well, one at a time. Then after doing that, I'm going to be counting the limbs of the baby and the toes. If the toe nails are 5, 1, 2, 3, 4, 5, 1, 2, 3, 4, 5, and also checking for the creases on the sole of the baby's feet. Then I'm doing the baby skin reflex as well by running the finger across the center of the sole of the baby, and the baby is going to extend its claws. And when I'm done with that, I'm looking at the baby thoroughly again to check for the presence of any birth mark or birth injuries or bruises, and if there is any, I'm going to be taking note of it down on the body map of the baby. Then I'm going to be turning the baby towards the back and also checking for this as well, if there is presence of any birth mark or birth injuries or bruises. Then I'm going to be checking for the spinal integrity of the baby by running a hand across the spine and also checking if there is presence of spinal bifida. And then I'm going to be looking for the patency of the anus, if there is an anal opening on the baby's buttocks. Then I'm going to be doing the Moro reflex, which is gently letting the baby fall onto my other arm to check if the baby is going to fan the arms. And then I'm going to be doing the stepping reflex of the baby by placing the baby in a way of making the baby want to take a step, which is a primitive step. Next thing, I'm going to be doing the gallant reflex, which is running my hand across the side of the baby, and the baby turns the hip. The baby usually turns the hip towards the side that I'm running my finger across. Next, I'm going to be doing the sucking reflex and the rooting reflex. The sucking reflex, I'm putting a finger or on the baby's mouth and expecting the baby to suckle it with a clean glove. I'm going to be changing my glove, or I'm going to be doing that when the baby is sucking on the baby mother's breast. And the rooting reflex is putting my hand at the side of the baby's cheek and expecting the baby to turn the mouth towards the side that the finger is. When I'm done with this, I'm going to be taking note of my measurements and then documenting this on the chart. Okay, I'm done with this now, so I'm going to remove my gloves now and complete my chart. I'll let you know if I find any abnormal thing. All right?
Okay.